This is the second video about hazardous materials in healthcare institutions. It's about hazard communication. For more videos, visit my Facebook page, Healthcare Quality. Hazard communication is a form of warning in the workplace. It ensures that workers who may be exposed to hazardous chemicals know about it and understand how to protect themselves from exposure. Joint Commission International (JCI) defined the Hazardous Materials and Waste Program to include processes for the inventory of hazardous materials and waste that includes the material, the quantity, and the location, handling, storage, and use of hazardous materials, proper protective equipment and procedures during use, spill, or exposure, proper labeling of hazardous materials and waste, reporting and investigation of spills, exposures, and other incidents, proper disposal of hazardous waste, and documentation including any permits, licenses, or other regulatory requirements. Why do you need to know this information? Everyone working with hazardous materials has the right and responsibility to be aware of the hazards and the proper safe work procedures for hazardous materials used or produced in their work area. The primary objective is for you to know how and where to find specific hazard information. Be safe, not sorry. Inventory should include list of chemicals and quantities, list of all locations where chemicals are used, and should be updated annually or as needed. The WHO identifies hazardous materials and waste by the following categories. The hospital considers these categories when developing an inventory. The hazardous material and waste program starts by doing a thorough search for all areas within the facility where hazardous materials and waste may be located. Documentation of this search should include information about the locations, types, and the quantities of hazardous materials and waste being stored, and should be updated when any of these items changed. Here is an example of hazardous material inventory, where we find the name of the department, the name of the product, hazardous materials found in this product, manufacturer, labels needed, current MSDS, and the maximum quantity on hand. Material Safety Data Sheet, or MSDS, is an important component of workplace safety and is intended to provide workers and emergency personnel with procedures for handling or working with hazardous substances, with information on the safe use and handling of a product. GCI defined information regarding procedures for handling or working with hazardous materials and waste in a safe manner must be immediately available at all times and includes information about the physical data of the material, its toxicity, what effects using the hazardous material may have on health, identification of proper storage and disposal after use, the type of protective equipment required during use, and spill handling procedures, which include the required first aid for any type of exposure. Many manufacturers provide this information in the form of safety data sheet or material safety data sheets. Who are MSDS for? Employees who may be occupationally exposed to a hazard at work, employers who need to know the proper method for storage, emergency responders such as firefighters, hazardous material crews, emergency medical technicians, and emergency room personnel. Material safety data sheets should be readily accessible, complete, and retained. One person in each department should be responsible for managing all MSDS. Here is an example of a material safety data sheet for sodium hydroxide known as caustic soda. MSDS is used internationally, although different countries have different content requirements for these documents. An internationally harmonized 16-heading MSDS format has been developed and is documented in American National Standard Institute (ANSI). Here are the information required in this international form. When you no longer use a hazardous chemical in your workplace, you don't need to keep its MSDS. However, you do need to keep a record for at least 30 years of the chemical's identity, locations, and the years in which it was used in your place. Labels are required on each container to identify hazards and risks. They vary in size. They alert the user to the chemical. And we discussed in detail the labeling system NFPA 704 in the first video. If there is no label or you cannot read the label, stop. Do not use the chemical. Tell your supervisor. Read the MSDS and have another label put on the container. You should never have any unattended, unlabeled containers in your workplace. To store hazardous materials, we should take into consideration the compatibility. We should organize our chemicals and store them properly. We should use approved storage cabinets and ensure that storage area is well ventilated. All workers handling hazardous materials should receive training within a specific time. Attendance is mandatory and must be documented. A qualified and experienced individual should be responsible for the program with the following qualifications. We have two categories of training, general and specific. In the general training, we explain the HAZCOM program, including information on labels, MSDS, and how to obtain and use available hazard information, and hazards of chemicals, in addition to protective measures such as engineering controls, work practices, and the use of personal protective equipments, and how to detect the presence or release of a hazardous chemical. The specific training includes the HAZCOM standard and its requirements, operations in their work areas where hazardous chemicals are present, location and availability of the written hazard evaluation procedures, communications program, lists of hazard chemicals, and the required MSDS. Here is an example of hazardous materials and waste management program. The objective of this program is to develop systems that address the identification, selection, handling, storage, use, and disposal of hazardous materials and waste. Hospital director or his nominee, along with Environment of Care Committee, are responsible for developing a hazardous material and waste management program, and to devise means to ensure that the procedures are followed. It's the policy of the hospital that flammable liquids, toxic chemicals, and highly reactive chemicals identified as hazardous substances shall be handled in a manner which poses no substantial hazard to human health and shall not be deliberately discarded with the general waste or by any route into the sanitary sewer system. The handling and disposal of this material shall be in compliance with this policy and all local and national regulations. Components of the program: identifying processes for selecting, handling, storing, using, and disposing of hazardous materials and waste, from receipt or generation through use or final disposal. In an effort to reduce the use of hazardous materials, the Safety Committee and the Director of Material Management review literature and make recommendations regarding less hazardous products to the safety officer. Establish written criteria consistent with applicable laws and regulations to identify, evaluate, and inventory of hazardous materials and waste used or generated. Providing adequate and appropriate space and equipment to safe handling and storage of hazardous materials and waste. Managing chemical, chemotherapeutic, radioactive, and regulated medical or infectious waste, including sharps. Emergency procedures that describe the specific precautions, procedures, and protective equipment used during hazardous materials and waste spills or exposures. Reporting and investigating all hazardous materials and waste spills, exposures, or other incidents. Performance standards for staff knowledge, level of staff participation, monitoring activities, incident reporting, and equipment testing and inspection for the hazardous materials and waste program. Orientation and education program for personnel who manage or have contact with hazardous materials and waste. The objectives, scope, performance, and effectiveness of the hazardous material and waste management program shall be evaluated annually. Responsibilities. Each department head or supervisor of area in charge, in coordination with safety warden, is responsible to know and keep track of inventory of hazardous materials in their respective areas, how the hazardous materials are stored, used, and disposed of, how their area fits into the overall organizational plan for dealing with hazardous materials. Fire and safety officer at each site is responsible for helping each department in making the site-specific hazardous material management program and periodically checking that the program is being followed. Head of maintenance department is responsible for providing technical assistance if required by any section in dealing with hazardous materials and waste, arranging different types of container for segregating the different types of waste required, arranging for the collection and disposal of wastes of different categories separately, coordination with municipality waste disposal department for disposal of wastes of different categories. Chemical spills procedure. First, evaluate the spill. Are the materials innocuous, corrosive, flammable, toxic, or explosive? Identify all materials by common or chemical name. Estimate how much is spilled. Evaluate the degree of danger to patients, staff, or visitors. Evaluate the degree of danger to equipment or property. Then, contain the spill. Utilize any action designed to prevent the spilled material from spreading and causing increased damage. Evacuate the area if the spill cannot be contained or if the spilled material produces irritant odors, flammable vapors or explosive vapors. Clean up the spilled material. Spills of innocuous material can be cleaned up by laboratory personnel or equipped staff. Spills of acids, bases, and flammables and mercury can be cleaned up by laboratory personnel using appropriate neutralizers or absorbents and proper personal protective equipments. Spills of toxic or explosive material and large spills of corrosive or flammable materials shall be handled by the Health Service Executive. Have the following information available: your name and phone number, precise location of spill, exact description of what was spilled, any steps you have taken to control the spill, and any injury that have occurred. Employees who have been exposed to hazardous chemicals due to a spill or other uncontrolled situation shall promptly report to the staff health clinic or to the emergency room when the clinic is not operating. A report of incident shall be completed by the individual's supervisor. Exposure to formaldehyde. Formaldehyde in healthcare is used as a preservative in medical laboratories, as inflaming agent in mortuaries, or as a treatment for athlete's foot, in cough drops, skin disinfectants, mouthwashes, spermatic creams, or as a disinfectant for root canals. Chemical description. Its formula is HCHO. It's a colorless gas with a pungent, suffocating odor. It's highly flammable gas or a combustible liquid. Vapors may travel to a source of ignition and flash back. Poisonous gases are produced if it catches on fire. Containers of formaldehyde may explode in fire. Routes of exposure. In clinical and laboratory settings, exposure to formaldehyde typically occurs through inhalation and skin exposure. Inhalation occurs when containers are left uncapped, heated, or instruments are not properly vented. Formaldehyde should be used in a chemical fume hood. Skin exposure occurs when formaldehyde is in contact with the skin or eyes. Proper personal protective equipment should be worn to minimize the amount of skin contact. Health effects. Formaldehyde is a potential human carcinogen. Airborne concentrations above 0.1 parts per million can cause irritation of the eyes, nose, and throat. Excessive inhalation of vapors can cause acute respiratory distress, chemical pneumonitis, and bronchial asthma. Skin contact may cause various skin reactions, including irritation and sensitization. Health effects may be acute or chronic. For acute effects, eye and respiratory irritation can result from exposure to liquid and vapor forms. Severe abdominal pains, nausea, vomiting, and possible loss of consciousness could occur if ingested in large amounts. The chronic effects occur when high concentration of vapor inhaled for long periods that can cause laryngitis, bronchitis, or bronchial pneumonia. Prolonged exposure may cause conjunctivitis. Nasal tumors have been reported in animals. Know the health effects, and if you experience any, report them to your supervisor immediately. How environmental health and safety monitors exposure. An assay technology ChemDesk monitor for formaldehyde is worn for at least 15 minutes or the duration of the procedure. The monitor is collected and sent for testing. A report of the results is distributed to the supervisor and the employee. When does environmental health and safety perform air monitoring? Initial assessment and potential air monitoring to determine baseline with current use and controls. Then annual monitoring to monitor employee exposures. And also periodic monitoring when initial results are above the limits or there is a change in the procedure. Air monitoring results are compared to OSHA and ACG IH limits. Here are the employee exposure limits for formaldehyde by OSHA. If exposure exceeds any of these limits, changes must be made to reduce employee exposure. All mixtures and solutions composed of 0.1% or greater formaldehyde and all materials capable of releasing formaldehyde in excess of 0.1 parts per million must include a warning that formaldehyde presents a potential cancer hazard. Procedure for spills and leaks. Wear suitable personal protective equipment. Do not touch the spilled material. Stop the leak if it is possible to do so without risk. Remove sources of ignition. Isolate the area so others do not inadvertently become exposed or transport the spill material. If you cannot safely handle the spill, contact Environmental Health and Safety immediately. Mercury Spill Plan. The purpose of this plan is to provide all employees with information regarding the potential hazards of mercury to both health and environment, and to identify the need to observe basic safety precautions while handling mercury. Mercury is a heavy silver white metallic element that produces a poisonous vapor. Unless treated with caution and respect, mercury can cause poisoning to humans that are exposed to it. Properties of mercury. 1. It is difficult to contain within a controlled area. 2. It has a long-term adverse effects on health if accidentally ingested. 3. It precipitates from a liquid state to a toxic gaseous state under certain ambient conditions. Number 4, it can be difficult to clean up safely after spillage. 5, it's quite frequently handled with careless familiarity without the hazard potential being fully appreciated. 6, it's highly corrosive to specific metal materials, especially those of the aluminum content group. Mercury may be contained in the following: thermometers, sphygmomanometers, barometers, specialized medical devices, and maintenance measuring devices. Whilst handling mercury, the minimal safety clothing involves wearing of polyethylene rubber or PVC gloves and face masks to cover both mouth and the nasal passages. In addition, safety glasses are recommended. The mercury spill kit consists of mercury vacuum hand pump, mercury sponge, stainless steel adapter tube, rubber gloves, face mask, mercury absorbing powder, and disposable bag or container. Upon receipt of a call of mercury spillage, respond immediately to reported location, ensure that you have the necessary mercury spill kit, ensure that patients are removed from the affected room prior to starting to clean up the spill. Ensure that no contaminated furniture or equipment was removed from the room between the time of the spillage and cleanup. Ask Biomed for their assistance in retrieving the mercury spill. Ensure that the housekeeping supervisor is informed and present at the scene. All mercury droplets must be removed from all surfaces, both horizontal and vertical. Mercury must be collected carefully to ensure that it doesn't spread. Procedure: in case of large spill, pick up mercury droplets with a mercury vacuum pump. To pick up mercury droplets in small cracks, use the stainless steel adapter tube. For small droplet spill, when mercury strikes a hard surface, it frequently breaks into many small droplets. These droplets must be removed because they significantly increase the mercury vapor concentration due to the greater exposed surface area of the mercury. Try to pick up as many droplets as possible using the mercury vacuum pump. On a level surface, use a mercury sponge rough side up. The rough side contains the active material that will amalgamate mercury. Dampen the sponge with a small amount of water and wait for 1 minute before using. Excessive water may reduce the ability of the sponge to pick up the mercury. With the active side down, slowly wet the contaminated area. The mercury droplets will be amalgamated by the chemical layer on the sponge. Upon completion, return the sponge to its disposable plastic bag and hand over to housekeeping for disposal. Mercury in deep cracks. Sprinkle mercury absorbing powder directly over the mercury and then wet the powder. Allow the mercury to react with the powder and water so that an amalgam is produced. This will reduce the vapor level. Pick up amalgam with a mercury vacuum cleaner and dispose of it in accordance with hospital policy. Mercury spill on carpets. Droplets that fall on carpets are very difficult to remove, especially in deep pile carpets. Follow these steps to clean up spills on carpeting. If the area of the spill can be isolated, the mercury hand vacuum pump should be used to pick up the visible particles. To remove particles too small to pick up effectively, the mercury absorbed powder should be used. Pour a quantity of powder into a container, add water to the powder, still let stand for 5 minutes. Drain off any extra solution. Apply to the contaminated area, working the powder into the rouge so it can react with the mercury. After the mercury has been converted into an amalgam, it may be safely picked up with a mercury vacuum cleaner. Pour mercury amalgam into the waste container for disposal by housekeeping as per hospital policy. Radiation safety. Establishes rules and recommendations to minimize radiation exposure risks to employees and patients in radiology through training, periodic safety surveys, use of radiation protective devices, and posting of caution signs. Occupationally exposed persons shall wear a radiation monitoring device and shall have access to the monthly radiation dosimeter report, which lists the amount of radiation each staff member was exposed to per month, per year, and total permanent accumulated dose. The radiation exposure of any occupational worker shall be controlled so that limits are not exceeded. Warning and notice signs shall be posted throughout the department in all languages needed. Laser safety. The word laser is a shortening to light amplification stimulated emission radiation. Always wear goggles whenever operating the laser machine and follow the instructions of operations. Consult the physician in case of any problem. Never use a defective laser machine. Contact biomedical engineer for any problem with laser machine. Hazardous Materials and Waste Management Committee rules and functions. The committee must meet on a regular basis, for example, bi-monthly or quarterly. Problems must be addressed and resolved in a timely manner. Minutes must be documented. Committee chairman must have direct line of communication with department heads. Committee information must be shared with department heads and executive management. This committee could be part of the Hospitals Safety Committee. Thank you.